Contemporary Issues in Advancing Practice, presented by Michelle Oldfield. I qualified as a nurse in 2011 and I am currently studying the MSc Advanced Clinical Practice Programme and Contemporary Issues module. I am going to deliver a presentation based on contemporary issues with advancing practice, which also relates to my current role as trainee ACP/nurse practitioner in a GP surgery. The presentation covers the ACP role. I will briefly cover some key points relating to contemporary issues relevant to my practice, but will mainly focus on the issues relating to education versus experience. I have used the assessment brief to help structure my presentation. What is advanced practice? It is a broad term. In Health Education England, formalised in 2017, describes the ACP as healthcare professionals educated to master's level or equivalent, with the skills and knowledge which allows them to expand on their scope of practice to better meet patients' needs. ACPs work across all healthcare settings and work at a level of advanced clinical practice that pulls together the four pillars of clinical practice, leadership, education and research, and they are deemed competent to work autonomously or with very little support. Sheffield Hallam University states the ACP course and education is designed and suitable for experienced registered healthcare professionals looking to progress into advanced clinical practitioner roles. Extinction and sustainability. Will the role last or fizzle out like other roles have done? Articles in the Nursing Times back in 2019 stated that primary care was currently facing extreme pressures with higher workloads and an increasing demand for patient appointments. Could employing advanced clinical practitioners help deliver and expand services in the future? And did this pave the way for an evolving role to meet patients' needs? This has later proved to be true. There are lots of questions that remain unanswered. For example, with no regulatory body currently, is it just another plug in the system to fill the gap for an already struggling NHS? Will it be regulated eventually? Will nurses, ACPs be covered by the NMC, or will we need another regulatory body in the future? Digital badges are quickly becoming an essential part of modern learning experience. Badges are web-enabled indicators that can be verified online in real time, allowing practitioners to show their abilities in a digital way. Not only do badges provide learners with a way to showcase their skills and accomplishments, but they also help employers easily identify qualified candidates for open positions. Digital badges recognise and celebrate learning or professional development achievements. Additionally, they offer representation of standardised recognition of the quality assurance of education, training and experience. In addition to the image-based design we think of as a digital badge, badges have metadata to communicate details of the badge to anyone wishing to verify it or to learn more about the context of the achievement it signifies. Together, this data should provide all the information needed to understand what the badge signifies. For example, who received the badge, who issued the badge, and what was the criteria for issuing the badge, and does it expire? Will this be a way to be regulated in the future? However, an international journal for Advancing Practice 2024 addresses the challenges ACPs are encountering in claiming these badges. It included inconsistencies in recognition for non-accredited education programmes and the uncertainty surrounding ongoing accreditation processes. The article suggests that future studies to explore this further. It is still a relatively new area and no studies have yet examined the impact of digital badges on ACPs, employers or patient care. Education versus experience. Higher Education England states that an ACP should be trained to level 7 or equivalent, and even though I consider myself to be, I sometimes find myself asking the opinion and seeking reassurance from a clinician who has worked at that level for many years but without a master's degree. Does this mean experience still can outweigh education? However, there are newly qualified nurses coming out of university with the expectation that they can progress to ACP or AMP in the next 3 years. The NMC states that they want to make sure that nurses are consistently educated to a high standard so that they are able to deliver effective care at the point of entry to the register and throughout their careers. They are committed to developing their education requirements to ensure that nurses are equipped with the skills and knowledge they need to practice now and in the future. However, they don't educate or select students. This is done by approved education institutions and practice partners in line with the NMC standards. They don't set curricula. This is done by education institutes and practice partners, and they don't regulate students' progress. If there are any concerns about the student, this is dealt with by the Education Institute. They also don't assess the quality of care in hospitals or community. This is the responsibility of other regulators such as CQC in England. So how far does education alone take us, and where does the experience prove a valuable contributor to our practice? What makes us safe? In nursing, the revalidation programme enables the NMC to audit our continued development and commitment to our roles. Looking at recent job adverts, being trained to master's level is still often listed as desirable, whilst working at this level and having experience is always classed as essential. Does this still have something to do with role pattern recognition? For example, in my role and background as practice nurse, if someone presents for a smear test or a women's health issue, I would always know what to do. However, if someone presented with a more complex medical issue, I may not be competent, and this is the most important aspect of recognising my own limitations and clinical boundaries within my role and adhering to my professional conduct. However, as we feel less confident in other roles, is this where education benefits us and gives us the passion and transition into a more advanced role and expand on our already existing experience? Looking at strengths and weaknesses, what does experience give that education doesn't, and vice versa? At a macro level, to enable a clinician to study at master's level, they must have skills and experience through clinical practice. At a more meso level, experience does help in practice. Could it be through pattern recognition or peer-to-peer support from an already experienced clinician? And at a micro level, how do we know we are competent and know where our boundaries are? Changes in workforce. For example, the NMC states that only a registered medical practitioner or a practicing midwife can provide assessments and pregnancy-related care for a pregnant woman. AMPs in general practice settings may find themselves being asked to provide care for non-pregnancy related conditions that may have an impact on pregnancy, or could be called upon to provide care in an emergency. Clear referral pathways must always be in place for such scenarios. Advanced clinical practice is central to helping transform service delivery and better meet local health needs by providing enhanced capacity, capability, productivity and efficiency within a multidisciplinary team. So does this mean that another ACP who is not a nurse could deal with a pregnant lady or non-pregnancy related illness, and who would regulate them? Or is it just the midwife? The advanced nurse practitioner over the past 20 years has evolved within general practice as well as secondary care. They are expected to work more autonomously now. These roles are known by a variety of titles, including ACP, and are each defined by different competencies and qualifications. As such, this has created confusion for employers in the past, as well as fellow healthcare staff and patients. For example, an ACP with a nursing background would be less informed about musculoskeletal than an ACP from a physio background. However, they are both expected to do the same job. This is where experience and clinical skills acquired overlaps education, as both ACPs would be trained and educated to master's level, but both come from very different clinical backgrounds. So what is right and what is wrong? To help standardise the role of the ACP in primary care, it was identified by the national framework. This aids and helps to structure professional boundaries. Nurses have in many ways been the pioneers of advanced and enhanced roles within many settings, including general practice. The NHS needs a workforce that is fit for the future, and nurses with advanced clinical practice knowledge and skills will be able to both lead and work within and across teams to provide excellent care for people. This framework is for nurses working in general practice. care at the level of advanced clinical practice, ACP, and throughout the framework they will be referred to as ACP primary care nurse. However, even with the framework in place, it still causes confusion amongst different clinical settings and domains. Mansi et al. 2023 studies showed that ACPs contribute to improved patient outcomes, increased patient satisfaction and cost-effective healthcare delivery. Additionally, their presence supports the development of junior staff by providing mentorship and guidance, thus ensuring a sustainable healthcare workforce for the future. In my experience, patients appear grateful for us as they are seen and successfully treated. Greenwood 2019 agreed that pressures on primary care services were making it more difficult for patients to access GP consultations. This literature review explored the role of the advanced clinical practitioner in primary care to determine whether they could support overstretched general practice teams, and it found that these practitioners have been shown to improve patient satisfaction, alleviate pressure on doctors, and provide high quality care when they work as part of a team. It concluded that advanced clinical practitioners have an important role to play in supporting and enhancing primary care service. However, historically, a comparative study by Donnellan et al. 2013 used a survey to examine attitudes of ACPs and doctors about the expanding role of ACPs in primary care, and GPs' attitudes back then towards ACPs were mainly negative. Will perception ever change, and will the ACP continue to be accepted? And what will influence that change in the future? Moving forward, so Nursing Times 2019 stated that ACPs have been shown to improve patient satisfaction, alleviate pressure on doctors, and provide high quality care when they work as part of a team or within their scope of practice. Considering the current pressures on GPs, ACPs could support and enhance services in primary care, particularly if they could spend more time with patients. Could there be nurse-led clinics or ACP clinics in the future? It is important to understand the framework in our part of the UK and keep an eye on national developments. Identify any requirements or guidance about advanced practice in your area and look at weaknesses and build on these. Identify and seek MSc programs on offer from universities within the area and maintain a good and accurate portfolio of evidence, and always work within your scope of practice, and ensure you have an accurate job description and adequate indemnity cover. Developing as an ACP is challenging. Generally, it will involve a senior registered nurse or other clinician leaving their comfort zone to learn and take on new knowledge, competencies and skills. With the correct training and support, the ACP role can be really exciting and provide job satisfaction and excellent patient care. I remain an experienced nurse who is now educated to master's level, working autonomously in clinical practice under my clinical lead, but will always value education, as for clinicians, patient care is a lifelong learning programme and we can never know too much. For this reason, I will continue to study throughout my career to enhance and advance my already acquired skills through experience I have already gained. Thank you for listening.